Welcome to the Chairman's Perspective Podcast.
Hello, I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners. You're listening to the Chairman's Perspective, and today we're going to have Dr. Reginald Coopwood, President and CEO of Regional One Health. Today we're going to talk about the state of Regional One Health. Regional One cares for some of the most traumatic and challenging cases, often with the highest profile and highest risk. You won't want to miss this show. Come back to the Chairman's Perspective on the KUDZUKIAN Network.
Jazz, America's own original musical art form. When did it start? Who were and are some of the major players? How do you distinguish what kind of jazz you're listening to? We talk about the great and lesser-known artists, songs and tunes, the instruments, and the social impact jazz has had on world culture since its beginning at the start of the 20th century.
Riffin' on jazz on the KUDZUKIAN Network. KUDZUKIAN!
Well, welcome back. You're on the Chairman's Perspective, and today I'm with a very good friend, Dr. Reginald Coopwood. He's the President and CEO of Regional One Health. Today we're going to talk about the state of Regional One Health. Regional One Health cares for some of the most traumatic and challenging cases, often with the highest profile and highest risk. Dr. Coopwood, thank you for being here and taking time out of your very busy schedule.
Absolutely, my pleasure.
Dr. Coopwood, for those of you, I can't imagine too many people that do not know your name. You lead a dynamic organization here that saves lives each and every day. But let me ask you this, a little bit about your background. Where's home? How did you get to this place at Regional One Health?
Well, I have to say now my home is Memphis, Tennessee.
Right.
I was born and raised in Nashville, Tennessee, spent almost 50 years of my life there, and I've been in Memphis for the last 10. I am a trained surgeon, a physician and surgeon, and I practiced general surgery in Nashville for 15 or so years and transitioned from clinical practice of medicine into administrative work where I was the chief medical officer at Nashville General Hospital. Wow. And then for 5 years before coming here, I was the CEO there.
Wow. So I can't imagine the responsibility you have, President and CEO of Regional One Health. And again, at the opening, I talked about you have some of the most challenging cases. Regional One is one of those places where you pray you make it there if you're in an accident, but it's one of those places you really don't want to ever have to darken the doors of. Every day, Dr. Coopwood, I meet different individuals who say, they saved my life. They saved my baby. I was involved in a fire and Regional One helped me. What's the experience like day in, day out, being the CEO and president? And also with your training as a surgeon, how do you transition from being a surgeon to really having to be the guy that makes the payroll, takes care of operations? How do you make that transition?
Well, I'll answer the first part of your question first, and that's, we provide through our centers of excellence around trauma, burn, high-risk obstetrics, and our neonatal center. We provide those life-saving services to not only this community that we live in, Shelby County, but also the region. And in that process, we have no peers in trauma. We have no peers in burn. We also are similar in a high-risk OB with the University of Tennessee. The key is, as it relates to those entities, people don't want to darken our doors.
Right. But
we also, and this is part of kind of our, what we're looking at is our 10 years of change, our decade of change with Regional One Health. We do want you to come to our hospital for elective care.
Okay.
So if you need to see a primary care physician or you need to have your gallbladder removed, we seek to be an option in this community with the other fine hospitals in the Memphis area. So that's kind of where we handle the exciting things. We handle motor vehicle accidents, gunshot wounds, and recent shooting in Forest City. They came here for care. But we also want to take care of those things that everyone else needs on a daily basis when it comes to their health care. How did I transition from private practice into administration? Well, I enjoyed surgery as what I wanted to be since I grew up. Was a successful surgeon and enjoyed it. Had an opportunity to see the transition into administrative aspect of healthcare. And then when I came to the realization in surgery, I'm helping one person at a time. When I'm running a health system, we have over 15,000 discharges in a year, and I can now create a healthcare system where 15,000 people touch it. And with our intention and what we do, we're trying to help them. So at a larger scale, we can provide healthcare a lot broader than I could one at a time.
So a lot of people in this region hear about level 1 designation, which I had to look up the definition, Dr. Coopwood. It says it's a multidisciplinary team of highly trained specialists in a center 24/7, waiting for you to arrive in the need of medical attention. So Regional 1 Health is the only level 1 trauma center in this area?
Correct. The nearest level 1 trauma centers are in Jackson, Mississippi, Nashville, Tennessee, or Little Rock. And so it's a expensive proposition to be ready, because you can be in our trauma unit and nothing's going on, people are talking, and then in a split second it'll fill up. Wow. Whether it's filling up with severe automobile accidents, 3-wheeler or 4-wheeler injuries, falling off a ladder. We hear on the news about people getting shot and they went to Regional 1 Health, but that's probably 20% of the traumas that we get. Most of those traumas that we see are things that you and I could be involved in, getting on the top level of the ladder. I'm just going to sneak up here to the top, and it falls, and now we're in the trauma unit. Wow. And so we seek to be able to provide that. It's expensive. We have 4 operating rooms 24 hours a day that are fully staffed just in case. Some nights they're all a lot of the nights they're all in use, but it's being prepared for what this region sends to us when the everyday person is involved in some kind of traumatic experience.
Well, Dr. Coopwood, the listeners are listening to the Chairman's Perspective on the KUDZUKIAN Network. And again, we're with Dr. Reginald Coopwood. He's the president and CEO of Regional 1 Health. Dr. Coopwood, tied to the Trauma Center, Regional 1 Medical Center is also home to MedCom, the Regional Medical Communication Center. Can you tell us a little bit about that?
It's housed there within our facility, mainly because, and it is responsible for directing ambulance traffic. And since we have the highest level of emergency services as a level 1 trauma center, they were housed there when I came 10 years ago, and they're still there. And it helps to direct where those emergency goes. And if we're not, and other hospitals have specialties in neurology or heart attack, and they will send them to the nearest hospital that has a specialty that the individual who needs emergency transport is at.
So it's not surprising that we see a lot of those massive air ambulances landing, those helicopters landing at Regional 1.
Absolutely, from all over. It's an amazing thing, and on days how many times the helicopters take off and land from our roof, bringing somebody whose life has been changed by some event.
Wow. Well, again, you're listening to the Chairman's Perspective on the KUDZUKIAN Network. We're going to be right back with the president and CEO of Regional 1 Health, Dr. Reginald Coopwood. We'll be right back.
The Chairman's Perspective on the KUDZUKIAN Network.
Hey, I'm Williams Brack, co-host of Grind Set. The insight you gain from us and our guests will motivate you to take the leap into entrepreneurship. Make sure to check us out on Spotify, Apple Podcasts, TuneIn, Stitcher, or your favorite podcast provider.
Grind Set on the KUDZUKIAN Network. KUDZUKIAN!
And we're back on the Chairman's Perspective. Today I've got a dear friend with us, a community leader, a healthcare leader, Dr. Reginald Coopwood, who's president and CEO of Regional 1 Health. Dr. Coopwood, we talked a lot about the trauma center, the only level 1 trauma center in the area. But also the Firefighters Burn Center has almost 100,000 Americans who are hospitalized each year due to serious burns. At the Firefighters Burn Center right here in Memphis, you help return people back to normal lives. I think that's one story I've heard over and over and over. With, I've pondered this before, with so many improved OSHA regulations, and you see, at least for me, a layman, you see far less, chemical companies these days. But so where do the burns that you see at Regional 1 Health come from?
Well, that's an interesting thing because it's again another service that is there strictly just in case.
Right.
And quite a few are house fires, individuals involved in house fires.
And we do have a lot of those in our area.
Unfortunately, we do. In the fall, people burn brush and it's not burning fast enough, and they'll throw a little gas on there to help it take off, and they end up in our burn center. And so it's not just Memphis and Shelby County, but it's also that region, and we are just got a certification from Mississippi to be able to be an option for the state of Mississippi because they don't have a burn center within their state. They have one outside of Jackson. It's kind of a triage for one that's in Georgia. And so our unit has, I think, 8 ICU beds and 8 recovery, 8 to 12, and we keep them full, unfortunately, because of the amount of people who end up needing the services of our burn center.
Yeah, I read that you treat over 500 patients annually, including 300 inpatient admissions in the Firefighters Burn Center at Regional One Health. That's a lot of people being burned when you think about it.
It really is.
You think it's fairly isolated, but again, what a blessing it is to have Regional One Health in our community in terms of trauma, burns, and also the life-saving work you've done. And you've had so many amazing people. Each year, nearly 5,000 babies are successfully delivered at Regional One Health. 25% of those are high risk. So when we talk about high risk pregnancies, Dr. Coopwood, what are we talking about? What do you see at Regional One?
So quite a few of them are women who haven't had any prenatal care, so there's no knowledge of how their first 8.5 months went, and so they're placed in a high-risk category a lot of times just because they don't know. Then you have women who develop eclampsia or preeclampsia, which is having severe high blood pressure, which puts the mother at risk of having a stroke, and so they're referred. When they have evidence of preeclampsia, they're referred to our maternal fetal medicine physicians, and then those who are going into premature labor are referred, and sometimes women will stay in the hospital for a month or two trying to keep the baby in utero within the woman's uterus long enough for the lungs to develop, but sometimes they create a situation where we have to take the baby in order to save the baby's life and the mother's life. And so that's where all the high risk comes in, is we all think about a 9-month normal pregnancy, but unfortunately every woman who is pregnant doesn't have that experience.
Well, if you just tuned in, we're with Dr. Reginald Coopwood. He's the president and CEO of Regional One Health. We're on the KUDZUKIAN network. Dr. Coopwood, we've talked about the Elvis Presley Trauma Center. We've talked about the Firefighter Burn Center. We've talked about high-risk OB. And at the beginning of the show, you talked about you also want to be a good choice for those in the community that have routine surgical needs, routine, I guess, colds and accidental breaks. In terms of where Regional One Health is located, if I am sick or I need to get my gallbladder removed or my appendix is hurting, where are the locations for Regional One Health, and how can people better access health care through your means?
So I want to answer that question, but I do want to say something, because we have these centers of excellence that are hospital-based, but we have which I think is a excellent opportunity, is we have a good relationship with the University of Tennessee.
Yes, sir.
So all the physicians who run and manage the trauma center or University of Tennessee physicians, all those who manage our high-risk OB or University of Tennessee, as well as our burn surgeons. And so we try to provide the service and the facility, but it's the doctors of University of Tennessee who, in their specialty, help us achieve those goals. And so I don't want to make it sound like we're doing it all on our own, but it is a collaborative effort with the University of Tennessee and their physicians.
I've been blessed over the years just to meet some of your trauma surgeons and what they see and what they experience, but yet their sense of coolness and able to be calm during a very difficult time when, families are dealing with something they thought would never happen after an auto accident or a shooting or, quite frankly, just an accident. It's amazing to see the level of care I've seen from your physicians and your nurses and even the security guards who are outside helping you try to park really quickly.
Yes, and I think our physicians are second to none and stand up with any major academic center across the country in what we're achieving. To your original question, and thank you for giving that opportunity to plug that relationship, but to your original question, we have physician practices on campus. We have physician practice, a provider practice at Harbor of Health, over in Harbor of Health for Harbortown, for that community. We have services in both North and South Memphis, as well as our practices at our East Campus at the corner of Quince and Kirby, right there off 385. So we have imaging center there. We have a pharmacy there. We have specialty practices. And we just opened a practice for our nurse practitioners and midwives just down the street on Kirby. It's the Kirby Primary Care. And we've incorporated into our practice sites primary care physicians or PCS, which is Dr. Jeff Warren's practice over off of Walnut Grove.
Very good. We're going to come back in just a little bit. We're going to talk about the state of healthcare at Regional One Health. As you and I both know, we struggle as a county with a lot of people that live in poverty. I have to imagine that affects Regional One Health. So I certainly want to come back and talk to you, Dr. Coopwood, about the state of health in Shelby County, what your role is in proactive health care. So we're going to be back on the Chairman's Perspective with Dr. Reginald Coopwood, President and CEO of Regional One Health, and we'll be right back in just a moment.
The Chairman's Perspective on the KUDZUKIAN Network.
Funking up your airwaves and jamming the good information in your ear. Once again, it's Funky Politics.
Funky Politics.
Funky Politics.
And we're back on the Chairman's Perspective with Dr. Reginald Coopwood, a great friend and guest, healthcare leader right here in our community. He's the president and CEO of Regional One Health. And today we're talking about the state of healthcare, especially at Regional One Health. Dr. Coopwood, at the end of the last segment, we were going to talk a little bit about the challenges specifically in Shelby County. While you treat a lot of ordinary patients like myself and our neighbors, you also treat a lot of people who, because of our community rate of poverty, are very challenged. So what are some of the diagnoses really specific to poverty that you see that you're challenged to provide on a daily basis?
So because of our kind of historic public hospital safety net role in this community, we have a higher percentage of the uninsured or underinsured in this community than any of the other hospitals. I've been in this role for 10 years, and we've made significant improvements in how we perform as an organization and the things that we've been able to do. But when you look at treating individuals in poverty, so much of it is not necessarily their healthcare needs. So much of it is what we call social determinants of health.
Yes, sir.
Environment, housing, ability to afford their medications. And so for years, they would show up at our emergency room in high numbers, and we would treat whatever complaint they came in with and send them back. We could be discharging them back to the street. And so when we started looking at this and saying, okay, let's wrap our arms around all these individuals who are accessing healthcare through the emergency room, and when they come in, let's put them in. So we created a program called One Health. Okay. And it's a program that is allows us to really do wraparound services. We collaborate with community agencies. We got our initial funding from the CC Foundation to be able to pull the data and to be able to put the care teams together. And this has been an extremely successful program in getting people who have high needs and high risk in their healthcare, put them in more of a stable environment where they can get their healthcare needs as well as their social needs, which is probably sometimes is more pressing than their healthcare needs. And we've been able to get people back into housing. We've been able to get people jobs. We've been able to get people in a more stable environment for them to be able to be higher productive citizens where they were just caught in this loop before. And the data on this program is significant and probably way too much to get into in this conversation. But it's a great program that we've developed and grown, and we've probably treated over 500 people who are either remain in the program or those that we've graduated out into a more stable life environment for them.
Dr. Coopwood, if we've got a friend or a neighbor that we know is struggling in some of the areas you talked about, how do they get in touch with One Health? Can they go on the Regional One Health website? What's the best way to understand some of the services at One Health?
There is information on our website, but just call the hospital and say you want to get in touch with Megan Williams, who runs this program, or One Health. And they'll reach out and pull them in the program and help them get the help they need, which isn't always health care.
Very good. Well, again, we're on the Chairman's Perspective with Dr. Reginald Coopwood. We're talking about the state of health care, especially at Regional One Health, and it's been a great show thus far. Dr. Coopwood, we've just got a little bit of time left. Shelby County government, and as the chairman of our board, we're honored to partner with Regional One Health. We do provide a small subsidy, quite frankly, in terms of your overall operating budget. It's important, but it is small in terms of everything you've got to do. Like you're a nonprofit organization, so you do some fundraising. You have the Regional One Health Foundation, and my understanding is this year's the 10th anniversary of your gala?
It is. When I came to town, I asked Tammy Ritchie, who runs our foundation, is our vice president for development, how about we do a gala and raise awareness and funds for Regional One Health? And she and her team took that suggestion literally.
Right.
And we are now having our 10th anniversary of that event on April 18th. It'll be at the FedEx Forum this year. And exciting lineup of artists that it's a good time. It raises money and awareness for Regional One Health. And if you get an opportunity to come and buy a ticket or buy a table.
Absolutely.
And it is a fundraiser, so it's not a $30 ticket.
No, I understand.
And so, but it's a good time every year.
And it's called the 10th Year One Night Gala. It's Saturday, April the 18th, 2020, and it's going to benefit the Regional One Health's work. We've talked about so many things. We've talked about regular health care today. We've talked about the burn center, the trauma center, high-risk pregnancies. Anything else, Dr. Coopwood, you'd like the listeners to know about Regional One? I feel like I've learned, even though we've been friends for a long time, I learned something new about you today, and I learned some things about Regional One Health. But what would you like our listeners to know about Regional One that they may not know?
First of all, I'd like to thank the taxpaying public who invest part of their property tax dollars through the county to support Regional One Health. And with about a $500 million expense budget, when you look at a $29 million subsidy, as a percentage, it's not a high percentage, but it is a significant amount for what we're able to do to take care of the indigent of this community as well as the prisoners. And so, first of all, thank you for the county, the representatives of all this community, and the community, in investing in that. But we're looking at and trying to assess and working with the commission to try to assess what the new facility may look like in the future. And hopefully as we get closer to that, we'll be able to share it with the county and the public and to see how that goes.
Well, there's no doubt that the work you're doing is greatly needed in our community, but also, as you shared, Dr. Coopwood, the facility's getting older, and no facility, after a couple of years, it has a lot of wear and tear, especially with the amount of individuals you serve. And it's time for a thorough review by our county government to look at Regional One Health. I know we're going to do that in the coming months. We're going to work together on looking at a strategy, especially when nearly 100,000 trauma patients have been served served at Regional 1. It's amazing to think about the lives you saved, the additional birthdays people have enjoyed.
Absolutely.
Thanks to your work, and thanks, you said it several times before, but the surgeons, the nurses, the staff members, all the way down to the folks that bring a warm meal at the bedside, to the chaplains. A lot of really good things are going on. And I want to thank you, just as a citizen of Shelby County, for the work you've done leading Regional 1 Health. It is not an easy job, but we appreciate all you've done.
Thank you, and it has been an honor to be able to serve this community in this capacity.
Well, hopefully many, many more. And again, you're listening to the Chairman's Perspective on the KUDZUKIAN Network.
20 with Tanya, presented by the Commercial Appeal.
20 minutes of the challenges and opportunities, we face in Memphis, but also a lot of the things nationally that concern me and that should concern other people as well.
20 with Tanya.
On the KUDZUKIAN Network.
I want to thank you for tuning in to the Chairman's Perspective. Today we had a great guest, Dr. Reginald Coopwood, President and CEO of Regional 1 Health. We learned a lot about Regional 1 Health that's caring for so many of us when we least expect it. I want to thank the staff of Regional 1, the nurses, the doctors, the staff that come in each and every day saving lives right here in Shelby County. A special greeting to all of our Shelby County government employees that work very hard each and every day to deliver the very best of services and programs. I hope you'll tune in again and listen in to the Chairman's Perspective right here on the KUDZUKIAN Network.
The Chairman's Perspective Podcast. Executive producer, Shelby County Commission's Chairman, Mark Billingsley. Directed, produced, recorded, and distributed by KUDZUKIAN.